I enter into the room. I give my mark sheet to the examiner with a smiling face. The examiner is telling, and hi, I'm Dr. Ima. Hello, I'm giving my introduction to the examiner. Examiner giving me the command, do the examination. Suppose he is Robert. Robert is an 11 years age old boy. Do his lower limb examinations. Robert is come with his mom. Suppose Diana. Okay, so do the lower limb neurology examination is my command. So first I wash my hand, I introduce myself. Hello Robert, I'm Dr. Emma, one of the candidate to examine your lower limb examination. It's okay? Okay. So in the meantime, I take the permissions. So Robert, how old are you? Okay, are you studying? Okay, so I'm noticing because he may be nystagmus. We know that I is voluntary movement and in staccato speech or not. Mentally, how is he? I pass the comment accordingly what I find, and look at him the face and his dysmorphic features, and I handshake with him. We give a smile. I see there is any facial nerve paralysis or not. Then I leave his hand. I see that slowly he's releasing his hand or not. And look at the surrounding, any device, any special shoe, wheelchair, anything he has taken or not, distress he is not, dysmorphic features, everything, 4D I check it. Then I am telling his lower limb neurology examinations, can he remove his shoes and socks, he will be stand up. I sit down, I look at his leg. So I find there is a pes cavus, that is not planus, pes cavus, his lower limb, and also distality is so much worsted that it given the inverted champagne like bottle. So you understand that is Charcot meritooth can be one of the DD of these patients. Okay. Then leg I go the back. Back I am going back. I'm seeing that any scoliosis, kyphoscoliosis, anything, any scar mark I'm noticing. Then gait I'm telling, can you please go this room, walk and come back. Then I look at that. That is a high steppage gait. That is he is raising his knee from the floor high and first touch the toes to the floor, then the heel. Okay, it's like a march gait. So I understand it is a Charcot meningitis. It is giving me strong. Then I will Rumbach test as this is Rumbach test. He will be stand with close his eye. I will give the both hand in front and behind that he cannot fall. He will be fall. That is Rumbach is positive. Then we go back. I tell, can you please lying on the couch? I will expose him. I inspection his leg, any deformity, bug, everything. Okay, I given good inspections. Then tone, I ruling right leg and left leg ruling. Then bending, flexion, extension of the knee, both one by one. Ankle also doing tone. I'm checking. So I find hypotonic tone. Then power, he will be raise his leg against the gravity. Then against the pressure, I give a hand beside that, can you give the pressure, I want to see, checking this power. Then go the reflex, knee, ankle and Babinski, everything I check, negative. Babinski is negative. Okay, then a Hilshin test I'm showing him, do let me, so he's doing that. And Hilshin test is also normal. And then I'm going for upper limb. I tell that I'll postpone the sensation, I'll do later. First I want to check the upper limb. Then upper limb power, he raised his hand and also against the gravity I'm checking. And then I tell that I'd like to complete my examination doing the full neurology examination. Upper limb, when I inspect the hand, I find there is claw hand, Charcot arthropathy it is called. So I understand it is a case of Charcot meritooth disease, hereditary sensory motor neuropathy. My positive finding today, I have the opportunity to examine Robert, who is an 8 years age old boy. I find there is he is small average for his age. He has staccato speech. Suppose he has nystagmus, staccato speech present, and there is no device, no distress, no dysmorphic features. Then I go the leg. What I find that is inverted champagne like leg. Distal muscle is wasted and Charcot. There is pes cavus. I find child health march like gait. Okay, high steppage gait. What I noticed. And tone power reflex is reduced. Babinski is negative. Upper limb, I find there is a claw hand. So putting together, it is a case of Charcot meritooth disease, hereditary sensory motor neuropathy. So they can ask me DD, differential diagnosis of the DD are bilateral and unilateral. Bilateral Guillain-Barré syndrome, Charcot meritooth disease, peripheral neuropathy due to diabetes mellitus, vitamin B12 deficiency, drugs as vincristine. Unilateral causes are like any trauma, fibula fracture, common peroneal nerve injury, and spinal tumor. Very important. Spinal tumor common exam. So how can I manage if it is a Charcot Marie Tooth disease? First of all, I take the history. I will revise the note. While investigation already done, I will check. I'll run some tests. First of all, genetic testing because it is an autosomal dominant conditions and chromosome number 1 is involvement. Then going to the nerve conduction velocity, it is severely slowing show. Nerve biopsy giving the onion bulb appearance, and I also do the back X-ray because of any scoliosis or anything I noticed. Management purpose, first of all, knee joint, that is orthopsis, foot orthosis, support knee joint, okay, because severely wasted distal muscles. Then we go give the tagritol and phenytoin for burning sensation of the leg, and also physiotherapist. Multidisciplinary team I'm going to involve neurologist, physiotherapist, occupational therapist, psychological support to the family, like the school, orthopedics. These are. So this is Charcot Marie Tooth disease. Thank you.